What causes psoriatic arthritis?
People can have genes that predispose them to arthritis. Luckily, in India, those genes are not that common.
Can psoriasis or psoriatic arthritis affect other body parts?
So this is a very interesting question. That the way that patient asks you the same question, they'll ask me only. They will say that, sir, I don't think my disease of skin and joint is connected. So
the patients ask us whether psoriasis is curable or not. They want a yes or no answer to it.
These are the patients where we can't do anything.
Okay. Can weight reduction improve the pain in psoriatic arthritis patients?
Patients of psoriatic arthritis who are visiting us, they're towards little overweight side, right, compared to other arthritis. So obese patients have more chances of transformation from psoriasis.
Doctor, are you telling me just because of the skin rash, am I more prone for diabetes and hypertension? Patients are not believing me when I say that.
So for the patients of Subramaniam and patient of ours in general, I would like to tell
no consultation is complete without this question from the patients. What are the diet changes should I make to improve my symptoms? Psoriasis or psoriatic arthritis?
The reason why it is not in textbook is because the food habits are different around the world. So what do we suggest to our psoriasis patient is to take
on the occasion of World Psoriasis Day, some few questions on psoriatic arthritis. Hi, sir. I'll start with a series of questions. I have some 8 questions. What are the common symptoms of psoriatic arthritis, sir, in a patient with either psoriasis or a patient who doesn't have psoriasis at all?
I would like to thank Dr. Subramaniam and his team to invite me over to speak about these questions. I'm thankful to them. And here we start with the questions. The first question that you asked was symptoms of psoriatic arthritis. In the patients of psoriatic arthritis, the most common symptom still is skin involvement. 80% of patients of psoriatic arthritis, they will start with skin first. So they will have some skin involvement and within few years, they will develop arthritis. In 10% of patients, psoriasis skin lesions and arthritis can present simultaneously. And in 10% of patients, it is quite possible that psoriasis will not develop at all, but they do manifest in the beginning with arthritis only. So after the skin involvement, there can be joint involvement. Joint involvement is in terms of your joint pain, swelling, tenderness, morning stiffness. Both small and large joints can be involved. Large joints of lower limbs like ankle, knees are commonly involved. And in small joints are commonly involved in hands, involving your distal interphalangeal joints and proximal interphalangeal joints. Means these small joints of your hands, these will be involved. Apart from that, patient of psoriasis, they can also have inflammatory back pain or inflammatory neck. They can also have low-grade fever-like condition. They can have malaise, fatigue. These are the common symptoms. If there is any kind of spine involvement, they will have inflammatory back pain. Means they will have early morning stiffness in their back when they're waking up. They will have frequent awakening in the nights. They will have alternate, their buttock pain will be there, and pain actually become little less worse when they start working, and the pain become worse when they go for sleeping or in the early morning hours. These are the common symptoms that patient will experience.
Second question, what causes psoriatic arthritis? Because this is a very common question that are asked by the patients in the OPD also to me. Like, I have skin involvement, what is the main reason for psoriasis or psoriatic arthritis? I'd like to hear from an immunologist or a rheumatologist perspective, in simple terms, while patients can understand easily.
So in simple terms, there is no single cause for psoriatic arthritis disease. Like other autoimmune diseases, there are multiple causes. One of the cause can be the genetic predisposition. People can have genes that predispose them to arthritis, psoriatic arthritis. Luckily, in India, those genes are not that common, but HLA genes are there, HLA B2717, these genes are there. Apart from that, one of the factors that is modifiable and important is smoking. People who go for smoking, they tend to develop big lesions, severe skin disease, along with they have more chances of developing arthritis. Apart from these, there are no other factors known for psoriasis.
Okay. One more question, sir. When people come to me with psoriasis, they think just that psoriasis is a skin disease. Can psoriasis or psoriatic arthritis affect other body parts?
So this is a very interesting question, because that the way that patient asks you the same question, they'll ask me only. They will say that, sir, I don't think my disease of skin and joint is connected. So what I'll explain then that psoriasis is not a skin disease only condition. Psoriasis is an autoimmune condition and multi-system disease. It affects your whole body part, right? Apart from skin and then apart from your joints, there are other organs which can be involved in psoriasis, including there can be enthesitis, or I should say heel pain, or the pain in the back of the heel, pain in your chest or over the spine. This is because of the enthesial ligament and tendon involvement. Apart from that, there can be involvement of your eyes. Patient can develop photophobia, pain, lacrimation in the eyes. Apart from that, these patients can have some of the gut involvement. It means they can have diarrhea, bloody diarrhea, nausea, vomiting, pain abdomen can be there. Where whichever part of the body will be affected by psoriasis can manifest the manifestation. So I should say that patients of psoriasis may be looking for the symptoms in their other body parts other than the skin and the joints.
Another common question: I'm practicing in a tier 2 city. Rheumatologists nowadays concentrated in tier 1 cities. These patients know when they have the joint disease, they usually go to an orthopedician or a general practitioner for the joint disease, thinking that this is treated like any other joint disease. What is the role of a rheumatologist, or what can he offer more than the other doctors?
Thank you for the question. I love the way that you touched the point of scarcity of doctors in our country, and that's how patients are not able to go to the doctor they want to. I would like to explain that because the disease is a long-term disease, it's a chronic disease, it will require long-term medication and follow-up. Also, orthopedician colleagues are more expert and more well-versed with the condition of the bones and the joints. Whereas the rheumatologist will be also looking for the other organ involvement, like I explained, these eyes involvement, gut involvement, or let's say other things are there, right? Since the patient may require therapy for a long time, patient may require higher therapies like biological agents and other things, it is always good to preferably to visit one rheumatologist, because rheumatologists are more well versed and more experienced with these drugs and patients. In the condition when rheumatologist is not available, they can go to general practitioner or orthopedic colleagues. But if a rheumatologist is available, it has been seen that the case if seen by rheumatologist is actually the outcome is very good. So rheumatologist will help you to see the patient in a holistic way to get all the consultation if they want to and the modified therapy accordingly.
Okay. I tell the patient, no, even if it's a 30-40 kilometer trip to see a rheumatologist, I still suggest them to go and see a rheumatologist, because the nearest rheumatologist here is like around 30-40 kilometers from the area I practice. I tell them like even the cost and the time of traveling, over a long period of time, you will have a better disease control. The rheumatologist can offer you a better disease control and a better quality of life than any other seeing a doctor of any other specialty. That's what I tell them. Okay, sir. One more question: is psoriatic arthritis curable? This is a very common question. And then once you tell the reality, the patient also they are taken aback by the reply what we give them. So, what's your advice to those kind of patients? The patients ask us whether psoriasis is curable or not. They want a yes or no answer to it. So, how do you respond to that?
I would go to this complicated question in a simple way. So I'll tell you what happens. Actually, everything will depend on multiple factors. First, including is that I should say in simple terms. Let me give simple straight answer. Out of 5 patients, 2 patients will be able to stop their medication totally. But that will depend on multiple factors. Patient who present in their disease early, patient who start their treatment early, patient who do not smoke, patients who are taking their medication on time, and patients who will not stop their medication without doctor's prescription are the patients who are likely to stop their medications. The problem comes when the patient starts and stops medication by himself or herself, and patient will not consult, patient will go to some other medication system, and that too also not be following too much, and patient who continue to smoke. These are the patient where we can't do anything. Apart from that, the patient who will present in their disease late, if already joints are damaged, joints are deformed, then the scope of treating their disease completely goes down.
Okay. Can weight reduction improve the pain in psoriatic arthritis patients, sir?
So
can weight reduction? Because nowadays obesity is a common problem in India because we are becoming more westernized. And
question that you asked about obesity and psoriasis is a good question, because we have seen that patients of psoriatic arthritis who are visiting us, they're towards little overweight side, right, compared to other arthritis. So it is known that psoriatic arthritis patients have more chances of diabetes mellitus, fatty liver, and hyperuricemia. So obese patients have more chances of transformation from psoriasis to psoriatic arthritis. Also, if some obese patient develop disease, they have comparably more poor quality of life. Apart from that, these new biological agents, these will show some less response in obese patients. So in that way, we can say that if we advise or suggest our patient to lose some weight, it will have overall positive impact on their disease.
Okay, sir. And when I tell the patients that you have a higher risk for a heart disease or hypertension or diabetes, they don't believe me. That's a problem. Can you just shed some light on that?
So the thing is,
doctor, are you telling me just because of the skin rash, am I more prone for diabetes and hypertension? Patients are not believing me when I say that.
So for the patients of Subramaniam and patient of ours in general, I would like to tell that what happens if you understand this thing. If your body has got a condition in which there is an ongoing inflammation, it increases the risk of formation of the arthromatous plaques in your body. We do know that psoriasis is a disease in which there is an ongoing inflammation in the skin. And now we have discussed that that is not the skin part only. There can be inflammation anywhere, including skin, joints, eyes, guts, and blood vessels also. So in that way, if you see a patient of psoriatic arthritis or psoriasis, let's say, they have some ongoing inflammation and formation of plaques. We do already know that hypertension, diabetes, and overweight are risk factor for cardiovascular heart disease. In that way, Dr. Subramaniam is not wrong in explaining you that you should actually reduce your weight, right? And you have more chance of heart disease.
Okay. So suppose if they are taking up weight reduction as an option, when should they start doing it? Because when disease is active, they cannot walk around that much, or their mobility will be a little bit restricted. How much can they exercise, and when can they decide to exercise? Can you just answer that?
So simple thing is, first thing is you have to get rid of your symptoms. If somebody is having severe pain or let's say severe disease, it is better to start treatment first. Once the pain controlled and the disease, skin disease is also a little bit controlled, then patients start with the exercise program. In general, the recommendation is to do at least half an hour of exercise daily for at least 5 days in 7 days time. And we tell them to do exercise of moderate to severe intensity. That means when you do exercise, you should have some breathlessness, you should have some sweating, and you should have some increase in the heart rate. So now the thing is, if somebody is not able to do that, in the beginning we will tell them to go for aerobic exercises or equivalent. Like we can tell them to in the beginning go for walking, then jogging we can start, and later we can start running. Or other aerobic activities can be done. Some people are also interested in doing yoga, right? So even doing yoga is good, doing exercise is good. Some people are fond of going for swimming, that is also good. Your body should be involved in some kind of exercise for at least for 5 days in 7 days for 30 minutes. That will actually improve your disease.
Okay. We all know that psoriasis can also affect kids. Can kids have psoriatic arthritis, sir, when they develop psoriasis? How much is the chance? Are they more prone than the adults? How is it?
Yes.
Can you just
Kids do also have risk of development of psoriasis and psoriatic arthritis. Luckily, we in our country we are not seeing those many cases. In fact, in India, the psoriatic arthritis in kids is less common than the other arthritis of the childhood age. But yes, if suppose somebody is having a family history of psoriasis or psoriatic arthritis, in those cases there are more chances of development of psoriasis in kids also. But in cases of kids, there is actually skin disease is less widespread. It is less complex, but the arthritis can be disabling because kids, they are in the growing age. If they do develop this arthritis, they can have deformities and they can have effect on their growth also. So kids also can have arthritis. If somebody is having psoriasis, then we should also look for the presence of arthritis in kids as well.
Okay, sir. Okay, this is the last question, and no consultation is complete without this question from the patients. What are the diet changes should I make to improve my symptoms? Psoriasis or psoriatic arthritis? This is a very common question that's not been answered anywhere, even in the textbooks. Like, what is your answer to the question?
The reason why it is not in textbook is because the food habits are different around the world. People do eat different foods, right? And it is difficult to do study also because we eat so many kinds of food. In that way, I can say that there are no scientific studies which have shown that particular kind of diet is associated with worsening of psoriasis. There are no studies like that. But because I already was talking about this, that because our patient are little chubby, little obese, they have high risk of heart disease, hypertension, diabetes are there. So what do we suggest to our psoriasis patient is to take a balanced, healthy diet which is less oily, less spicy, and less in the salt, because we do know that our patient is gonna have some cardiovascular increased risk of mortality. So we can go for a balanced diet that is sufficient.
Okay. Because I see a lot of patients, like there are other systems of medicine also like exist in the country, and they are seeing and rheumatology complaints like arthritis is one of the common condition for which people go to the other system of medicine also, because they're dissatisfied with modern medicine, and then sometimes they switch out to other practices. But other practices, they suggest a lot of diet modification, and these patients, they come back to us with a lot of nutritional deficiency because of the food restrictions suggested by them. Even in psoriasis, the protein intake has to be high. The skin regenerates. Because of these diet restrictions, I see a lot of patients who come to us with low albumin level in the blood, or that is low protein level in the blood, or with micronutrient deficiency, which is impairing their body to heal the condition. So I just wanted to know from your side, like, what is the best answer to the question?
I would like to add on your point that the reason why people do attach their diet with the disease, you would have seen some patient telling that if they eat some citric thingy, then the pain will increase, right? Or if they go for non-veg, the pain will increase. This is actually because this is the part of your cognitive conditioning. If somebody tells you that this will affect this thing, if somebody tells you this food will improve your symptoms, actually it happens. In that way it is happening. Otherwise, scientific data is actually lacking. And you're right, we have seen so many patients who will not be taking any these protein diets, or let's say some fruits or something else. It will lead to some vitamin deficiencies, and the disease will actually increase.
Yes, sir. Thank you so much for giving us a lot of clarity. And the most important question answered by you was psoriasis can be cured. That was, you gave a crystal clear answer, and you hit the bullseye in like giving the right answer for the question. Thank you so much for your time, sir. Thank you so much. Hope we'll have many more meetings like this in the future. Maybe offline meeting as well. Thank you so much for your time, sir.
Thank you.